Calling all the Cannabishes. Welcome to High Tea. High Tea is a high-vibe cannabis entertainment company for women who also love weed. This is a thoughtful and blunt exploration of pot and its magic, the role it has in the lives and processes of cool and creative people everywhere, and an evolving cannabis culture we're seeing happen before our very eyes. We're elevating perceptions with every episode. Listen up as we go in. Welcome back, my Cannabishes, to High Tea Life, a full spectrum exploration of pot and her magic, helping culture embrace cannabis. I am your grateful host, Jennifer Newton, also known as Newts, and this is season 2 of your favorite podcast. We've had a lot going on over here at High Tea HQ. If you didn't know, we just dropped our first of many fire shop drops in our new e-commerce experience, Zhuzh. This is a celebration of the magic in every one of us that Mama Wana, amongst other things, helps unlock. That's cjujz.com, so keep posted up in there for limited edition drops with hand-chosen artists and makers in the best of cannabis culture. We are also going on the road with our rolling parlors. Whoop, whoop. We'll be in Toronto, Calgary, and Montreal before the end of the year, so make sure you don't miss us. Join the invite list at hightea.life. We've also got some new content coming at you, but that's all we're going to say about that now. First episode of season 2 of High Tea, where we are going to talk to entrepreneurs, activists, doctors, actresses, athletes, you name it, in a deeper exploration of the power of the plant. So today, let's go straight to the source and talk to the power of the plant for our health and wellness with one of my favorite tweeters. Dr. Michael Hart is one of the world's foremost experts on medical cannabis and one of our country's pioneers in the space for implementing cannabis into his therapeutic toolbox, say, within his patient practice. Also, apparently, ketamine. He's the co-author of Amazon bestseller Friendly Fire, Why Vets Are Lighting Up and Ditching Pills to Treat PTSD. And his point of view has landed him on Joe Rogan. So make sure you guys check that out after you've listened to our episode, of course. So my chat with him last night has got me thinking ever since. It was so insightful and enlightening. And it's had me realizing that perhaps cannabis's lesson for us is exactly what it gifts or delivers to our physical and mental states, and that is balance. My favorite book ever, Cannabis and Spirituality, go get that if you don't get that, says the benefits of marijuana, we're going to call that cannabis. The benefits of cannabis are far-ranging, long-term, and not as instantaneous as the high. In the short run, the equilibrium that occurs is only temporary, and it reverses as soon as the high wears off. So the cannabis experience itself does not miraculously cure. Instead, it allows the body a respite from the tension of imbalance while exposing the mental confusions of the mind. Although in the near term, balance is easily lost, the essential tendency to homeostatic habituation, otherwise known as health, develops over time. In the long run, then, cannabis can serve as the vehicle by which the body-mind heals itself. So listen up as I ask Dr. Mike Hart anything and everything I've ever wanted to know about cannabis for our health and wellness. And we answer some listener questions too. This is season 2 of High Tea Life. So we are here with Dr. Mike Hart, somebody who I've wanted to talk to for a very long time and who, in actuality, I have talked to before, but we won't talk about that today. Hi.
Hi.
How are you?
Good. I'm glad to be here.
I'm so glad you're here. Thank you. It's nice to meet you in person in real life and like do the thing in real life.
I think so, so much better. I know the first time we kind of just did the audio thing, but I think that maybe, it didn't record so that we could meet each other in person. So
It
it all
recorded,
worked
but
out.
it crashed. So blame Mercury or whatever. But I trust the universe, divine timing, and here we are. So can you tell me how you got here? Like, and I don't mean by here in the hotel room that we're in. I mean, how did we get to a place where you're a doctor out in the real world shouting loud about the benefits of cannabis?
Sure. So I graduated from medical school in 2010, did my residency at the University of Western Ontario. So I started practicing medicine 2013, and then I started prescribing cannabis in 2014. And the reason I started prescribing cannabis was because there was just a lot of patients who weren't getting adequate relief. They were using medications and they weren't getting any type of benefit from it. And in fact, sometimes it's making things worse. And this has
Domino effect of problems, right?
Exactly. And I knew that it would be effective for a lot of different mental health disorders. I knew it would be effective for insomnia. I knew it would be effective for pain. So that's why I got into medical cannabis, and that's what kind of brings me here today. And that's why I do like discussing it, is because a lot of patients have benefited from medical cannabis, and they are doing very, very well. And it has helped a lot of patients wean off of several different pharmaceuticals. So I continue to use cannabis, and I think that in the future we're going to see more and more physicians using cannabis as a medical treatment.
Yeah, I think I call it polypharmacism or polypharmaculture, and I think it's like one of our biggest issues.
Yeah, so polypharmacy, actually, that's a really good point, because that's a big issue with a lot of seniors. I mean, it definitely happens
My parents are in that group,
to
yeah.
people who aren't seniors as well, but it's not uncommon to encounter a senior and for them to be on 8 to 10 different medications, right? And the beauty about cannabis is that it can help treat so many different conditions. So people who are elderly, they often can't sleep well at night, so cannabis can be great for that. People who are elderly, they often have a lot of chronic pain. Cannabis can be great for that. And a lot of elderly people are on mood disorder medications as well. So they have a lot of depression, they have a lot of anxiety. Using cannabis can be really helpful for that. So, I think that for people who are using a lot of different medications, they can in fact wean themselves off those medications with cannabis, because cannabis does have so many different indications.
That's amazing. So now you're not just talking about the benefits of the plant. Like, you're bringing this to the people, and you have a clinic that is what I like to call 420 friendly, right? It's
Yes.
just trying to figure out how to appropriately bring it into your life based on your health and wellness.
Right. So I have a family medicine clinic. So it's called Ready to Go Clinic. But, primarily what I do there is cannabis medicine. So, I just see cannabis as being, another tool in the toolbox that family physicians can use. And, that's my approach to it. So, I still do use other medicines. Recently, I was actually published because I used ketamine for some patients, and they got some excellent results with that. So, that's not the only medicine that I use, but yes, primarily, the thing that we do at Ready to Go Clinic is that we do family medicine, and we just see cannabis as part of that.
Okay, we're going to talk about the ketamine thing.
Sure.
Okay, but before we do, can you explain to me why something that is, I mean, it's not a panacea by any stretch, but can you explain to me why something that is so beneficial for so many different ailments, for so many different people at so many different points in their lives, and not to mention our endocannabinoid system, why was all of that ignored by the medical community until very recently?
So I think there's a couple different reasons for that. I think the main one, though, is that it's always been a Schedule 1 drug. Right. So because it's a Schedule 1 drug, you can't study it. And because you can't study it and research it, then physicians aren't comfortable prescribing it. Because if something's going to be built into the medical guidelines, generally there has to be a considerable amount of research and evidence from randomized controlled trials. And unfortunately, we do not have a ton of randomized controlled trials on cannabis. Now, that being said, we still have lots of other evidence. We have lots of associations. We have lots of epidemiological studies. We have lots of animal model studies. We have lots of anecdotal evidence. So, in my opinion, all that together is definitely enough to use and prescribe medical cannabis. But unfortunately, for mainstream medical physicians, until there's a ton of randomized controlled trials and until it gets built into the medical guidelines, into the curriculum, and into the medical school curriculum, which is something that which we're not taught about in medical school. We're not taught about cannabis at all. Until that gets built into the curriculum, I think that you're going to see a lot of physicians that are still going to be extremely apprehensive prescribing medical cannabis. And I'm sorry to give that message today, but I think that that is what's going to happen, and that's the reason why.
Oh yeah, I mean, my dad has Parkinson's, bless him, and all of his doctors are basically saying no. Like, they won't even kind of have the conversation.
And he has Parkinson's, you say?
Yeah.
Okay, so that's kind of interesting. I mean, I've probably got probably somewhere north of 50 but south of 100 patients on cannabis for Parkinson's. And I would say most of those patients experience at least a 30 up to a 50% decrease in their tremors when they use cannabis. It can also help with their gait as well. A lot of patients, like we just talked about, have trouble sleeping. A lot of patients with Parkinson's have trouble sleeping. It's a big issue.
And also the depression.
And
you lose yourself,
and
right?
the depression. They have this kind of like flat look on their face all the time.
Well, you're mourning who you were.
You're mourning who you were, and even just from lack of sleep alone, you can become depressed. You can become anxious. I guarantee anybody listening to this podcast right now, if you sleep 2 or 3 hours tonight, you're not going to feel very well the next day. Your overall well-being is going to be really low.
I feel like hell.
Yeah,
Jesus.
exactly.
Okay, so I now understand, thank you, why cannabis has been ignored by the medical community. But I don't understand why the endocannabinoid system has. Can you tell me a little bit more about what it is and how it works?
Sure. So the endocannabinoid system is something that we have in our bodies. So whenever someone uses the word endo, that means inside our bodies. Whenever someone uses the word exo,
I love etymology.
That means outside of our bodies. So endocannabinoids means that we are making cannabinoids. And there actually was a gentleman by the name of Dr. Ethan Russo who coined the term clinical endocannabinoid deficiency. Okay. So he believes that we can actually be deficient in cannabinoids, and that several different conditions are associated with that. So migraines, fibromyalgia, and IBS. So he actually believes that there's patients who are actually deficient in cannabinoids. So just like patients can be deficient in hormones, they can be deficient in vitamins. They can also become deficient in cannabinoids.
I think that's what I have.
You might.
I have 2 out of those 3 things.
Which ones do you have?
I don't know what fibromyalgia is, but
Okay.
I get terrible migraines.
Okay.
Ever since my 20s, like crazy ones, including a curious one I'll talk to you about offline. And maybe I should talk to you about it now, actually. I get a migraine called orgasmic symphalgia. Have you heard of that?
That's not something I'm very familiar with, no.
It's the name. The truth is in the names of etymology. It's like at the point it flips into a migraine.
Wow, that's
and the only cure is abstinence for like 2 to 3 weeks, and it's most commonly found in like middle-aged white men.
Okay.
Isn't it weird?
That is a really interesting finding. It's something
I get other ones too.
I'd like to look into.
Yeah, Google that one. Google, guys. Okay, so I won't ask you about that. But anyway, I might have endocannabinoid deficiency. Now, is that maybe why some people are magnetized or find themselves compelled towards the plant and other people don't, because it's actually doing what it is homeostasis? The plants are in behind you are like calling me.
I think what it would be is that, like, if you are in fact deficient in it, you're going to have a much better clinical response.
I see.
So say if we have two people who have migraines and one of them is in fact deficient in cannabinoids and the other person isn't, by giving both of those people cannabinoids, you're probably going to get a better response from the person who's deficient than from the person who is not deficient per se. So I think that, the people who are saying that, man, my migraine comes from like a 10 to a 0 when I use cannabis, they probably are deficient in cannabinoids. That probably is, the underlying, etiology that's causing them to have a migraine. Whereas, someone who says that they use cannabis and it takes their migraine from a 10 to a 7 or a 5, something like that, which is still very good relief. But, they may not, in fact, be deficient in cannabinoids. And, the treatment then is more or less just treating the symptoms, which is still fine. That's still an excellent treatment. But, you're going to probably get more of a response if there's a deficiency.
Okay, so on the other end of the spectrum, can you overdose on cannabis? And I ask that in a spectrum of ways. Number one, in just obviously there's a general like habitual balance issue, which I'm wondering, do you believe that's the biggest risk? Or can you go so far as to have a hormonal imbalance out of your cannabis or cannabinoid use? And then can you go so far as to be so sick that you have cannabinoid hyperemesis?
Okay, so just ask your first question
like
again.
If you basically, can you overdose?
Okay, so
obviously, like psychologically, mentally, or physically.
Number one, I want to say this, and I know most people have heard this before, but you can't die from ingesting cannabis. So you can't overdose. Overdose is a term that we often use when people are dead. So
I meant, sorry, I should have clarified.
No,
I meant, can you have too much?
That's okay. Of course you can. So you can't overdose and die from cannabis, but can you overdose and have a bad experience? Absolutely. So, one way that, I've talked about before with regards to preventing an overdose on cannabis is that if you're going to use edibles, what you need to do is that you need to use them slowly and you need to do it carefully. So if you take an edible, you do not want to take another edible for at least 2 hours later, because if you take a little bit of THC and you don't think that you're feeling anything, and then you take a little bit more, later on, both of those doses are going to kick in. There's nothing you can do about it. You've taken too much, and you might, as some people, say, they'll green out. What happens when that happens? Basically, people get really, really sick to their stomach. They feel very, very disoriented. They feel paranoid. They have hallucinations.
I greened a friend out on my weed not so long ago. He literally went unconscious, and he went unconscious 4 times. And we had to call the paramedics, and then they just let him go, and like whoop whoop the siren as he walked away.
Yeah, well, I mean,
he's obviously very sensitive.
The thing is, like, unfortunately, there's not much that the people at the hospital can do when someone does use too much THC. What you need to do is you just need to let it ride out.
And make sure you're not having a heart attack.
And you also, too, the one thing that I will say, if you are with someone who is having one of these really bad experiences, the one thing that you can say to them is that it will go away. So 100% of people who have experienced a green out have survived. So just remember that, if you're having a freak out, if you've used too much cannabis, just know that this has happened to millions of people before for many years, and no one has ever died from it. So you don't need to freak out. And the way that you're feeling now, if you're feeling super paranoid off cannabis, is going to pass. That's the message that you should be delivering to those people when they are in fact having a little bit of a freak out.
So can too much cannabis send someone's hormone system out of balance? Like a female, like I got a lot of questions about females using cannabis when they were trying to get pregnant, throughout pregnancy, and breastfeeding. Okay.
Well, I think one of the biggest indications for cannabis for women, in my practice anyway, is endometriosis. A lot of women struggle with
issue
with pelvic pain. And, some people just have the endometriosis right around their cycle, whereas some people have it almost the whole month. So, two different kind of types there. But a lot of patients have really responded well to cannabis for endometriosis. So it can be really effective for pain control. I saw a girl yesterday, I believe it was, and she says, she misses, 3 or 4 days a month because of endometriosis. And cannabis can in fact be, a very effective treatment for that. And just staying on topic with regards to hormones, a lot of guys always ask me, does cannabis lower my testosterone levels? And all the human studies so far have shown that cannabis does not lower testosterone levels to a significant level. So there might be a dip, but it's not anything significant or anything that you're going to feel. So, that's something just to keep in mind for the guys out there.
Cool. Okay, so, and what are your thoughts on cannabis hyperemesis syndrome?
So I think that, it's valid. I think that it does exist. You can have people just, showing up at emergency rooms, fairly frequently, and always, with a hot water bottle. I've seen it before.
Begging for a hot shower.
Yeah, begging for a hot shower. I mean, there must be something going on. I think there's some.
I mean, I'm going to tell you, I'm pretty barfy, and a hot shower is a really good place to be.
Yeah, I mean,
in general. I mean, if you're sad, get the fuck in there. I mean, seriously.
A hot shower can make your day better.
It really can.
But I kind of do like the contrast showers, like the cold showers. No. The cold shower is actually my favorite. But yeah, coming back to your question, I do think that it is valid. I do think that it is real, and it comes back to what we were talking about earlier, about addiction and taking too much. You can use too much THC. I recommend to my patients, try your best just to use CBD in the day, then at night, then use more of like a 1-to-1 strain. If you have to use, a heavy kush sometimes, fine, but just make it just for, crisis situations or, once or twice a week, stuff like that. Like using it every single night, you can develop a tolerance to it. So, you do want to avoid that. I know, in the cannabis community, a lot of people say that doesn't, that's not true. I mean, it's not true for CBD. I have patients who are on the same dose now that they were 5 years ago, say for something like seizures or for anxiety. They've never needed to increase the dose. And the same can be said too for, in my experience, for people using 1-to-1 ratio. So you can use THC every night, but you should use it with CBD. My experience though is that if people are using only high THC every single night, if they go a night without it, they're gonna like freak out. Okay, so you want to avoid being one of those people. You want to use cannabis as a tool that makes your life better, that makes you healthier. You don't want it to be something that you're completely dependent on, that if you don't have it, your whole life is over, everything's ruined and your night's ruined and you can't get through your day. So you want to avoid being that type of cannabis patient.
I love it. It's like cannabis's lesson for us is exactly what it does to our body, and it like delivers us back to balance. And if we abuse it, we ain't using it right.
Exactly. Yeah. If you're using it too much and you're starting getting these feelings that you need it all the time, that you're craving it all the time, take that as a sign that you're using a little bit too much.
Okay. Noted. Okay, so on that note, like, how do you balance talking about something that is ultimately a medicine, but is also so fucking fun? Because we constantly have this conversation between mad rag, who are you? How did you get into that? And then I've noticed that actually the industry is starting to call daily users wellness users, because for whatever reason, the CBD, THC, et cetera, endocannabinoid combination is making them feel better on a day-to-day basis. How do we balance something that is sort of both things and even talk about that responsibly?
Sure. Yeah. So, I mean, I think that's a reasonable thing to discuss because, there are people who say, for instance, if you have seizures and you use CBD, and then you don't have seizures anymore, how can you say that person didn't use a medicine, right? So I think that we're starting to establish that, and more people are respecting cannabis as a medicine. Are there people who use it recreationally? Of course. Are there people who abuse it recreationally? Of course. So abusers recreationally, as we said, they'll basically just use really high THC cannabis every night and develop a tolerance to that. And then once they develop that tolerance, they're going to be very dependent upon it. And then without it, they're not going to, they're going to be miserable, and they're not going to feel themselves. They're going to have a lot of irritability. So for those types of people, they're not really using it recreationally, and they're not using it, medicinally, because they're basically just abusing the medicine. Someone who may, use it recreationally, say appropriately, and cannabis has been legal now in Canada for over, a year. We have safe alcohol guidelines in Canada. So, we say that women can have up to 9 drinks a week safely, and that men can have up to 14 drinks a week safely. And, in my opinion as well, being sober 100% of the time is not necessarily like a badge of honor. I think that that's really good for people who have had past traumas and that have had past substance abuse issues. There's lots of examples of people who have, successfully quit, whatever they were using, and they've never gone back. And sobriety has worked really well for them. I mean, there's lots of celebrities. I know Eminem has. I know Steve-O has. I know there's lots of them out there. But for some people, being sober all the time may in fact not be the healthiest thing, because that slight break, that dissociation that you get, can be really therapeutic overall. So, to talk about it recreationally, for sure, I don't disagree with the Canadian guidelines on alcohol. I think, if you have 9 drinks a week for a woman, 14 drinks a week for a man,
That's a lot.
and if it takes away a little bit of stress and it makes you feel better, I think that's great. Obviously, if it's taking away stress in some ways, that's that you could say that it's used medicinally. But overall, I think that as long as you don't exceed those recommendations, then you're going to be in the safe zone. And then coming back to cannabis, I think that using cannabis as a substitute over alcohol, to get that dissociative effect, to get that break that you're seeking, is something that's reasonable. A lot of people would, and including myself, would argue that it's even that it's more healthy, particularly because there's no calories in it. Alcohol is filled with empty calories. So
I wasn't thinking calories. I was thinking carcinogens. I mean, I think alcohol is one of the biggest carcinogens in society that nobody talks about. And meanwhile, on the other end of the spectrum, not to make this conversation about one versus the other, but on the other end of the spectrum, you have something actually helping cure a cancer situation. I mean, I was recently hospitalized for being sick, and they were sure it was cannabis hyperemesis. And meanwhile, I was like, well, talk to me about the fact that I had 3 drinks last night and I never drank, and I had an empty stomach and hot flaming Cheetos. But let's keep going.
well, those are some bad decisions right there.
Some very bad decisions. Okay. So going back to what you were saying about the balance between CBD and THC and finding balance in our own practice, I personally think THC is like societally demonized somewhat. I'm happy that there's a huge narrative around CBD and a huge acceptance around it, but there are a lot of people who, when it comes to real pain, need THC. And, we'll flip into some of the questions that I got for you to close. And the first one was from my mom, who is only cool with CBD and is very much not willing to touch the plant in any other way, but truly doesn't believe that it's helping her or affecting her. But she's scared of THC. So she's dipped her toes in real pain situations to a one-to-one kind of spray situation. But her question is, she knows she needs it, but she's scared of it. So what do you do? Is
Okay.
it a talk to your doctor situation?
Yeah, so I mean, there's a couple different things I'll say on that. The first thing I'll say is that, I like you bringing up the fact that THC in some ways has been demonized compared to CBD. There are some indications where THC is better. And again, I wish
Like a
it
420?
wasn't the case, but if someone has neuropathic pain, so if you have sciatica, you're probably going to respond a little bit better to THC. Whereas, say if you have like arthritis or some type of repetitive injury, like you work in a factory or something like that, CBD is going to be better because it decreases inflammation. Whereas THC kind of blocks the signal that tells your brain that you're in pain. So that's why it can be so effective for neuropathic pain. The other thing too is when it comes to sleep, THC is much, much better than CBD for helping nightmares. So THC can really help reduce nightmares. It's a huge lifesaver for first responders and anyone who has PTSD. So very important that we don't demonize THC because THC is also a medicine.
Yeah, it's a marketing effort, I keep saying. I'm in branding. But in actuality, isn't the cannabinoid we need for sleep actually CBN? Which is like, is that even in my CBD? Like,
so CBN is another cannabinoid out there, and there has been some research on it that has shown that it can be effective for sleep. Recently, I was going back and forth on an email thread with Dr. Ethan Russo, who's a brilliant guy and one of the foremost guys on medical cannabis, and he actually thinks that CBN might be a little bit overhyped for sleep. So not necessarily, but there might be other cannabinoids that come out in the future that could be excellent for sleep. And in the meantime, I mean, THC and CBD have both been shown to be effective for sleep, both on their own and in combination. So we do have lots of good treatments for sleep, even without CBN.
So you're a full spectrum kind of guy, I'm gonna guess.
Definitely.
Good, as we all should be, right? Okay. How do you feel about combustion?
So smoking versus vaping, basically. Mm-hmm. So I prefer patients to vape over smoke. So comparing cannabis smoke to tobacco smoke is completely different. There's obviously significantly more carcinogens in tobacco smoke than there are in cannabis smoke. But at the same time, there are some studies that have shown that if you vape over smoking, you're much less likely to contract an upper respiratory tract infection, so you're less likely to get the common cold. And then there's just anecdotal evidence. I've heard from other people that when they smoke, they find that their performance, their cardiovascular performance is good versus when they switch over to vaping. So in my opinion, vaping is definitely the way to go over smoking. And then also too, we should really touch on this recent vaping scare, these mysterious illnesses. So these were all cartridges that were sent over from China. We have no idea what's in them, what the contaminants are. Like if you're someone and you have a good vaporizer, a good trusted device, and you also have good medical cannabis product, you're not going to get one of these mysterious vaping illnesses. It is absolutely completely safe to vape, and you should not have any hesitation about vaping, and don't worry about these mysterious vaping illnesses, because that's only coming from faulty cartridges from China that are contaminated with things. It's not from good medical devices and good medical cannabis.
But we should ideally vape fresh, like bud, like pure flower, right? Because I mean, there has not been a vape that doesn't make me like cough and phlegm, and I'm sure I don't have the stuff from China.
Yeah. I mean, that's a good point. So, one thing that people always believe is that, if I cough when I'm smoking, I won't cough when I'm vaping. Sometimes people do cough when they vape, so it is something to kind of like
it's more the
keep in mind.
Which for me, like, not to get TMI, but like for me, that's my body sign of like, there's something in here that you're allergic to, right? And a pure flower, that
you don't get that
happen
feeling
ever.
That's good.
Ever. But I'm a pure kind of plant kind of girl, so that's sort of my next question. Talk to me about plant medicine. We were talking about ketamine. I don't even know about ketamine. Is that a plant? I don't know. But, shrooms are obviously sort of on the horizon in terms of hopefully being legalized in terms of in a medicinal capacity. And, we're talking about other hallucinogenics. So what are your thoughts on that?
So I think that one positive that's come about from cannabis is that it's opened up the door to some other medicines. So, I certainly can't say this for sure, but, I would doubt that if cannabis had not been legalized, that we wouldn't see, the legalization of psilocybin in some places in the United States, and the interest in psilocybin. I think that the fact that cannabis is legal has really opened up that door. And we do have some research, indicating that psilocybin can in fact be effective for, various different mental illnesses. And actually something I only found out recently, and I put up on my Instagram and Twitter, is that there was actually shown that psilocybin may actually be effective for aging. So one of the things that's been linked to aging is shortened telomeres. If you're someone who really is who really does a lot of research on aging, so that's the thing that's been it's been associated with aging, and it's been shown that psilocybin may in fact hinder that progression, meaning that if people who use psilocybin, or it's been shown in studies anyway, that if you use psilocybin, you may in fact reduce your telomere being shortened, and then because your telomere will be longer, you'll be able to live longer. So that's very interesting. Also interesting too, from the same authors of the same study, is they found that a shortened telomere is actually linked to poor mental health. So we thought that short telomeres are only linked to aging, but short telomeres are also linked to poor mental health. And we do have, some evidence and anecdotal reports that people who use psilocybin do have an improvement overall in their mental health. So it's going to be very exciting to see, what happens in the future. And I hope that, one day in the future, I can prescribe psilocybin to people who, maybe are not responding that well to cannabis.
Word to Pachamama. Okay, so how about this? Okay, so shrooms don't get me high. Like if I microdose, I need to nap all the time. And the other weekend, I did 3 grams in the woods and nothing really happened. Like I saw cool visuals. That was it. Is that because that's not my medicine?
I don't know. I don't know the answer to that question.
I think I'm trying to dig out because we're human, like we're animals. Like you're sitting behind, I think it's because you're sitting behind this beautiful painting of a forest or photograph of a forest. And I just believe that as animals, we're sort of connected to the earth in a way that we've become extremely separated and removed from. And that maybe there's an intuition happening on a level we're not even aware of in our sort of inclinations towards certain plants versus other plants, or certain medicines, I should say.
Sure. I mean, there's definitely some validity to what you're saying, because, if you look at,
I'm also high.
For example, like ayahuasca, for example, if you look at that and the history there, how did they discover that, if you mix these 2 plants that, you'll get this medicine, somehow they discovered, that you needed an MAOI inhibitor, to activate the medicine in that plant. So, I understand that there may be some, intuition and things like that, but, just coming back to the psilocybin, I mean, for me, I would want, again, some robust randomized control trials, some epidemiological studies, something that would indicate that, this is safe for my patient and that it will work for them. So, hopefully, because cannabis is legalized, hopefully we'll be able to get more research onto some other plants like psilocybin in the future.
It's happening, isn't it?
It's definitely there's definitely more of an interest right now. There's already
in the States, right?
There's already, I think it's Oakland has it legalized already, and I think there's other places that are looking as well. I know Denver has it legalized, so I think that we may see a rapid progression in the research on psilocybin, and then hopefully that'll translate into a rapid progression on treating patients clinically.
So what was the ketamine experience?
So some people do group ketamine into that group of drugs, which is completely incorrect. So, psilocybin is a psychedelic, whereas ketamine is not a psychedelic. Ketamine is an anesthetic. Ketamine is used in emergency rooms, and it's used on the OR. So that's where ketamine is used. What they found in research is that people who use ketamine find that they can come off of their opioids, and they find that it's really effective for pain, and it's effective for depression. So I do have some patients in my practice who despite the fact that we gave them lots of cannabis and lifestyle treatments, they were still struggling with pain or still struggling with depression. So as I stated earlier, I'm a family doctor. Cannabis is just one tool in my toolbox. I do have other tools. I use ketamine for some of my patients. They responded really, really well, and because they responded so well, I had some researchers reach out to me, and we got a few case studies published, and I hope to get a few more of those published in the future.
Amazing. Okay, I got to read up on that. I don't know anything about it except that it's a horse tranquilizer, right?
It has been used,
Yeah,
yes. Yes.
Do you anecdotally, because I know you can't really tell me, but anecdotally, do you find that women are more inclined or more responsive towards cannabis medicine than men? Are we the reason I ask is I taped with your friend recently,
Okay.
Carlin Costa.
Yeah.
And in a recent chat, she told me that the less estrogen you have, the more THC you need. It
Okay.
was something like that. And that really kind of, it piqued the interest of me and our listeners, because as women, and this is a female flower, I'm just wondering if maybe there's something going on here. And then, of course, I'm thinking of my friend who greened out, who was obviously a guy. Are potentially we more, I don't know.
Well, I'm
responsive?
not saying you're incorrect. I just haven't come across that
So it's like
in my
50-50
research.
with your patients and stuff. It's
In-
usually down the line
in terms of
just people using it, responding to it.
Yeah, I wouldn't say that I've seen, more of a response to, one kind of gender than
Okay.
than the other overall.
Okay.
I would say that in general, like females might be a little bit more accepting of the medicine or willing to kind of try it than say men sometimes. But in terms of like clinical response, I definitely can't say that I've noticed that, men or women respond differently in any type of way. Yeah.
Okay, two more questions. Pregnancy and cannabis. I know perhaps you can't go on the record for these things, but I also know that there are a few interesting studies from other countries out there in the world that actually talk about the benefits of it. And I've had some questions on it.
So, as far as I've seen in the literature, THC is not something that you should be using during pregnancy or during breastfeeding. That being said, is CBD something that can be used during that time? I prescribe CBD to patients during that time, and they've done very, very well with it. And the other thing that helps during that time is that a lot of those patients, they're really stressed during that time, and they're still dealing with other injuries or other ailments that they have, not just the pregnancy. So meaning that they may have been taking a narcotic, or they may have been taking several NSAIDs prior to the pregnancy to treat their condition. And CBD is something that they can use during that time to negate a lot of the teratogenic effects that would come onto the fetus if they had kept using those medicines. So I think that if you can get some patients off of harmful medicines that we know can really harm a baby with the use of CBD, then it can be really effective for that patient population.
What about like an extreme hyperemesis, like vomiting situation? Is that still just a CBD case?
Well, in any situation in medicine, you always have to look at the risks and the benefits, right? So, there was risks for me, driving here today. There's risks if I, walk across the street. So anytime you're giving a medicine, there's always going to be risks and benefits, and you have to weigh those out. And in some instances, there may be a case or there may be an instance where, using THC would be more that it would be more beneficial than the harms. So the benefits would outweigh the harms. So in those situations, yes, but in general, as a rule, don't use THC during pregnancy.
Got it. Okay, what is the thing you've seen? I mean, you tweet a lot. You're like one of my favorite tweeters.
Awesome. Thank you so much. Tell that to our listeners.
I love a tweeter. I love a good tweeter. We'll tell them where to find you at the end. But what's one of the most sort of surprising or exciting things that you've sort of come across recently? In
terms of medical,
the world, yeah.
And medical
you can give it doesn't have to be about even cannabis, but like it should be probably.
Sure. Right now, the thing that I'm really kind of most interested in cannabis is the other cannabinoids. I know we didn't really touch on it here too much today. We talked a little bit about CBN, and I kind of said how that might be slightly overhyped for sleep. But, I'm really excited about the other cannabinoids. So meaning that, 4 or 5 years ago, almost nobody knew what CBD was. And now, CBD has so many different indications. It's so widely available everywhere, and so many people have benefit from it. But, there's over 100 cannabinoids in cannabis. So, I'm really excited about the research for the new cannabinoids that are coming out. I've talked a lot about this before, but I almost hesitate talking about it because it's not commercially available. But there's one cannabinoid called THCV. And the reason why I'm so interested in this cannabinoid is because it can help reduce appetite, and it can help with insulin sensitivity. It's been shown in randomized controlled trials, at least one anyway, to help with type 2 diabetics. So we know that, it can help reduce appetite, and we know that it can help with insulin sensitivity. So, that's a huge cannabinoid that I think is going to come out down the line because, so many people are struggling with being overweight these days.
I get that question a lot. How to get the munchies. Or how to not. Okay, last question, then we're done. Favorite strain?
Favorite strain?
Or cultivar, I should say.
Favorite cultivar?
Favorite cultivar.
I would say Avadecal.
What? Explain her. Is it...
Avadecal is a CBD strain. Okay. And it has a little bit of myrcene in it. I shouldn't say a little bit. It's predominantly myrcene.
I was going to ask you if terpenes are...
Yeah, terpenes
are... Are they efficacious?
Absolutely. Okay. Yeah, and that's why I counsel patients, like, if you want to use CBD at night, like after a workout, then using CBD with a little bit of myrcene is perfect because it really helps decrease the inflammation, helps you just feel really chill, and then also too you have the myrcene in there to just kind of sedate you even a little bit more. So to me that's just a perfect kind of post workout in the evening thing.
Diggity. I'll have to try that one. Okay, Dr. Mike Hart, this has been a pleasure. Fast and furious, as it is, because she was late, noon standard time. Can you please tell our people where to find you on all the things? Sure.
So you can go to my website. It's mikehartmd.com. I do have a couple free ebooks there that you can check out. I'm on social media. So I'm on Facebook. I'm on Twitter. I'm on Instagram. I'm on LinkedIn. And my handle is at Dr. Mike Hart. So that's DRMIKEHART.
Amazing. Thank you. This has been a pleasure. Was it good for you?
It was awesome. Thank you so much.
Thank you. This has been a wealth of knowledge. You are amazing. Great energy. Thank you for bringing it to the world. I hope we can talk again because I'm sure we're going to have a ton of questions from the people out of this. But this is already round 2. So anyway, thank you for listening today. We are happy and healthy at High Tea Life. Thanks for listening. Check us out on Insta at hightea.life. Like us and subscribe on Apple Podcasts, Spotify, SoundCloud, and all the other things. Join our invite list and holla at your girl by visiting hightea.life.